Understanding stroke. This education session is intended to provide you with information about stroke and its effects. The healthcare team members play a significant role in providing you and your family with the necessary information for developing coping strategies, making lifestyle changes, and being informed about stroke in general in an effort to prevent future strokes from occurring. The brain is the control center of your body. It controls how you think, feel, communicate, and move. Knowing what type of stroke you had and what area of the brain is affected is important. This presentation will help you understand stroke and give you some tips and strategies. I hope you have received your stroke journey booklet during your hospital stay. Most of the information in this presentation is also available in this booklet. In this module, we're going to talk about what is a stroke, the different types of stroke, and how to recognize the signs of stroke. A stroke occurs when blood stops flowing to any part of your brain. This interruption causes damage to the brain cells, and the effects of your stroke depend on the part of the brain that was damaged and the amount of damage done. When a stroke happens, the blood flow is disrupted. Some brain cells do not get the oxygen and nutrients they need. When the cells of the brain die, that area of the brain cannot function as it did before. Arteries and veins are types of blood vessels in your body. Arteries carry blood rich in oxygen and nutrients to your organs. Veins carry waste products away from your organs. Cerebral arteries are the arteries of the brain. Normal brain function needs a constant supply of oxygen and nutrients. An artery can become blocked, or an artery can burst. In both cases, if an artery is blocked or an artery has ruptured, blood stops flowing to an area of the brain and the tissues and cells die. This is known as a stroke. There are two types of stroke. Blocked arteries can cause an ischemic stroke, and a hemorrhagic stroke occurs when an artery in the brain breaks open. Most strokes are ischemic and are caused by blockage or narrowing of the arteries. A fatty plaque can build up along the inside of the artery. This can narrow the artery, decreasing blood flow and causing a blood clot to form. The blockage or clot grows as blood cells and fat cells stick to the plaque. Also, the blockage or clot can form in an artery in your brain, or it can form in an artery in another part of your body and travel to the brain. A blood clot can travel to the brain from other areas of the body, such as the heart. This is known as an embolic stroke. A hemorrhagic stroke is caused when an artery in the brain breaks open. The interruption of blood flow causes damage to your brain. High blood pressure makes arteries weak over time, and it is a major cause of hemorrhagic stroke. Weak spots in the arteries are called aneurysms, and they can stretch too far and burst. Sometimes called a mini stroke, a TIA, or transient ischemic attack, occurs when a clot briefly blocks an artery. TIAs are an important warning that a more serious stroke may occur. TIA is considered a medical emergency, and you need to call 911. Which type of stroke did you have? If you're not sure, make sure you ask one of your healthcare team members. The brain is divided into two parts called hemispheres. The right hemisphere of your brain controls the left side of your body, and the left hemisphere of your brain controls the right side of your body. Each hemisphere is divided into 6 regions, including 4 lobes that control different functions. This picture shows the parts of the brain and their functions. The brainstem is the area at the very base of the brain where it meets the spinal cord. People can have a stroke in their brainstem, which can affect many functions in the body. The brainstem controls your breathing, heartbeat, and blood pressure. It also controls your speech, swallowing, hearing, and eye movements. We are dependent on our brainstem function for survival. A brainstem stroke threatens vital bodily functions, making it a life-threatening condition. Stroke symptoms often happen suddenly, and every person's symptoms may vary. If you or someone you're with may be having a stroke, pay particular attention to the time the symptoms began. Some treatment options are most effective when given soon after a stroke begins. Having a stroke is a medical emergency. Recognizing the signs and symptoms of a stroke is important, and the need to call 911 right away. Do not drive. An ambulance will ensure you get to the right hospital. 2/3 of people with stroke are admitted to the hospital. Each person recovers at his or her own pace. Your care and length of stay is based on your needs. During your hospital stay, ask lots of questions to make sure you understand what has happened, what to expect, and your role in your recovery. A stroke can impact your ability to move, to see, to think, to feel, to communicate, and to swallow. Every stroke is different. Your recovery from your stroke can depend on how much of your brain was damaged, what area of your brain was affected, your health before your stroke, the work you do with your healthcare team, and the support of your family and friends. You are the most important person in your recovery journey. As much as possible, you should be involved in setting goals and planning your recovery. The healthcare team will work with you and your family to meet your goals and support your recovery. Thank you for taking the time to listen to this module. If you have any questions, please make sure you ask your healthcare team.